Good morning, good morning. It's very nice to have you here for this lovely podcast. This is the Endurance of Labor Laws, and this is episode 5. I am your lovely host, Lesley Sullivan. You can call in or email in anytime. You can call or text at 405-314-1119. Email address is Lesley2018Sullivan at gmail.com. That's Lesley 2018 Sullivan, Sullivan at gmail.com. And today we're going to talk about federal daycare. And what I mean by that is the federal government is trying to implement daycare at a federal level. And I, for one, do not agree with that. And I will say this, I am not a parent, I don't have any children. But even if I did have children, I would not want this. And we're going to go into more detail about the specifics of this and why it's coming about. And, you know, can there be some good things? Sure. But I think the cons outweigh the pros on this. And you kind of have to be careful about things that you allow the federal government to implement. So, first of all, this mandate that the current administration is trying to pass or get it to be accepted is where from the moment your baby is born, it is supposed to be, if this passes, if this gets enforced, the moment your baby is born, it goes into daycare immediately. And, you know, I don't know what the age requirement is, if it's like a month, a week, I don't know what. But this kind of daycare that's mandated by the federal government and supposedly paid for by the federal government is supposed to be mimicking what's going on in France. France has been doing this for a good while now. And just because it's being done in Europe, in one of those countries over there, it doesn't mean that we should do it here. And the French people are not happy about this daycare that's being forced upon its citizens by their government. And so what's going on in France, that's been going on for quite a while, is these parents are very much upset with their government because the government is not allowing them to raise their kids. So let's say, for example, you have a husband and a wife. The husband works, the wife stays at home and wants to be a homemaker. Well, if you have this mandate coming down the pipeline from the government that says, no, you're not going to have your kids at home, you're supposed to be at work, or even if you don't have a job, they want to have your children in forced daycare. And I personally just find that horrifying that a government would try and do that, because they're basically trying to control your children from the moment they're born. So when you have a government that's acting like that, that's very dangerous, because they're not even respecting the parents' rights to have children and to raise them in the way that they think is best. And I personally don't see a problem with someone wanting to be a homemaker. My mom was a homemaker. There was nothing wrong with that. Another thing the government does not want to allow is it doesn't want you to find a babysitter and let the babysitter take care of your kid during the day while you go to work. The government also does not want your relatives to babysit your kids or be the daycare for your children. So that poses a lot of problems because, number one, a lot of parents cannot afford daycare. That's a big problem there because it is expensive. It is a service and it is expensive. And if anything, more parents have been trying to go towards raising their own children. You know, having a parent stay at home for those first, 5 to 6 years of a child's life before they actually go into grade school. And so the government, they're trying to implement this, and it's not right, because first of all, not every parent fits that mold that they need to have daycare. You know, sometimes neither parent works, like they're so well off that they don't need daycare. So we really should not be forcing people to basically forfeit their kids for the day and put them in the care of somebody else when they may not need that. Another problem is, you know, I would think that, and I saw this with a cousin of mine who was put in a daycare, and I did not agree with this because her parents did not need to do daycare. Both of them had really good jobs, and they could have lived off of one income, but they refused to do that. They put money ahead of raising their kid. But I remember us going to visit them, and I was really excited about seeing my cousin, and she was probably 2 or 3 at the time. She's grown up now in her 20s or something now, but I doubt she remembers this, but she was like 2 or 3 years old. And she was put in a daycare, and I didn't know that she was in a daycare. And her mom, which is my aunt, picks us up at the airport, and she goes, well, I need to go pick up, I'm not going to say my cousin's name, but we need to go pick up my daughter. And so we're like, okay, let's go. And so I thought maybe her kid was like at a friend's house because she was too young to be in school at that time. So we go to this daycare. It was so dark and dismal, and they had all these kids in there. You had one section that was the older kids. They were all asleep on the floor. Like basically what these daycares do, they basically want you to be asleep to try and control all the kids. It's not always a learning session. It is not about education. It's about controlling the kids, right? So we walk in, the lights are off, it's dark, and you've got all these kids on the floor that are asleep, at least they look like they're asleep. And then you've got all these, they look like, they remind me of like incubator looking things at the hospital, like in a NICU, that all these babies are in it. They look like turkey roasters, but they're clear. And I was like, what in the world? So I have all these clear turkey roaster looking things lined up against the wall. It's a large amount of them. Well, they're all these babies in these little plastic crib things. And they're just all lined up. I was horrified as a little kid because my cousin and I were probably like 7 or 9 years apart. So I knew something was not right with that. And I was just horrified as a little child. I was like, this is not normal, because also I wasn't raised in that. My mom, was a homemaker. And so, we pick up my cousin, and she's kind of groggy, and, we get home, and I tell you what, I know I told off my aunt, because I said, I do not agree with you putting my cousin in daycare. That was horrible. If you want to be a parent, you need to raise your kid. You need to act like it. I was like, I know that I'm way younger than you, but that's my cousin, and I don't want her in daycare like that. And my aunt just got real quiet, and she got really pissed off. So, I know that I said a lot, but I was really upset as a little girl. I couldn't believe that my aunt would be okay with this. And they didn't need to have 2 jobs. They lived very comfortably. And I just was so taken aback by that, and it just felt wrong what I saw. So that was my first impression of daycare. My other impression of daycare growing up was so many kids could not stand daycare. They hated it. They wanted to be at home with their mom. Like my mom was one of the few homemakers in almost every single one of my classes. And kids just loved it and thought it was neat that my mom was a stay-at-home mom. And so when I got off from school, I would go home and my mom would be there. I was never picked up by a bus. I never had to go to a daycare. And here's another thing. These kids that go to daycare, they were sick all the time. It was horrible. Like I couldn't stand being around some of these kids because I was always getting sick. I was like, why are these kids just constantly sick all the time? So it's like we would just share all these infections. It was really bothersome, and I didn't like it. I mean, I loved having friends, but we all knew they're getting sick from the daycares, and there's all these different daycares in town, and hardly any of them were clean. And so another thing was with the daycares was that if your kid is sick, parents did not want to come pick them up because they wanted to work or they needed to work. Some parents needed to work. I'm not denying that. That's just their circumstance. But what sucked was, even if their kid was sick, they were taking them to daycare and just dumping them there. And then, or they would take them to school and just dump them there. And sometimes they very well knew that their kid was sick, but they didn't care because they wanted to go to work. They're like, I don't have time for this. Just, as long as the kid isn't going to die, just take her to school or daycare. Well, schools over time and daycares over time had to start implementing rules that you can't drop off your kid if it has a fever, or if they're vomiting or throwing up or have diarrhea, or if they have pink eye, like very contagious diseases. And it just kind of surprised me as a little kid, because whenever I was little, my parents never took me to school sick. You know, I stayed home and got well, and I didn't go back to school until I was completely well. And what was interesting about that was the schools didn't always like that. They're like, your kid needs to be at school. Like they would complain on both sides of it. They would say, we don't want your kid here if it's sick. But then if your kid is out more than a couple days, they get angry at the parents. Like, your kid needs to be here in school. Education is important. And it's like, okay, no. Education is second to the health of the child. So if a child doesn't have their health, then they can't go to school. So it was really kind of weird. And that was with public schools. I can't speak for private schools, but this was public schools. And so I just remember the schools not being very nice to my parents whenever I was sick. Because there was one time I got really sick. I got a really bad stomach bug, I think in 5th or 6th grade. And I remember it lasted over a week. It was brutal. I mean, it made me so mad, because I was like, I know what's going to happen. I'm going to get sick with what someone else has. Sure enough, I did. And then I was going to miss school, and I was going to have to do homework at home, even though, my schoolwork at home. And I hated doing that, because you're missing out on class. And I'd rather hear from the teacher of how to do all this stuff. So I'm having to self-teach myself this stuff. And then when I get back to school, even when I've completed all the work I was doing, I'm still a little bit behind. I hated it. And I get to school, and it's like I've missed out on so much of the fun and the drama of being a kid that I don't know what happened. Like, you know, who's got a crush on who, you know, who pissed off the teacher this week, you know, who got an F on a paper, and, you know, who got an A, you know, like the important things of being a kid at school, right? And I just hated that. But I just remember being a little kid, walking to class or walking to school, and there'd be all these daycare buses, all these daycare vans, and these kids, it was creepy. It's like they were drones. Well, that's kind of how the federal government is trying to do things right now. They're trying to mandate daycare. And there are some people that want daycare, but I don't think they understand that when you have it go through the federal government, that is not good. When it's mandated by the government, you don't really know what's going on. And here's another thing. Our country cannot afford to do that. Like, our tax dollars can't even afford to pay for all of Medicare and Medicaid and disability, and cannot even afford to pay for the health care of our veterans. So, and we have tremendous amounts of debt. Our federal deficit is just astronomical, and that's not even including all the stuff associated with different wars that we fought in. Like, we haven't had a balanced budget for quite some time, and that adds up, unfortunately. That's just basic math, you know. Like, I've worked in accounting, probably 12 or 13 years now, and you know, you have to have the numbers add up. And if you want to know how stable your company is, you do the math. Well, if you want to know how stable your country is, you need to do the math. And if you can't afford something, then you simply can't afford something. So I look at it this way. If I had children, and let's say I needed daycare, I still would not want it to be mandated by the federal government, and I also would not want that being taken out of my tax dollars or other people's tax dollars to pay for child care for my children. And, you know, as a single person, and, you know, I don't have any children, I don't want to pay for other people's daycare. That's their responsibility as a parent. And if they can't afford daycare, they need to find a way to afford it. And I'm sure that's going to piss off a lot of people, but I don't care, and here's why I don't care. You know, being offended about your own situation is simply you being offended about your own situation. And if I was in your situation, I would do what I've said in other podcasts. If I needed more money, I would apply to higher paying jobs. Like, whatever my income currently is, I would look for jobs that pay $5,000 to $10,000 more. So basically increase your income by $5,000 to $10,000 a year. And I give that range because there's no point in trying to find a job that only pays $1 or $2 more. That's not really going to cover stuff. So if you really want to be more financially stable, you need to look at it as, I want to increase what tax bracket I'm going to be in, because if you're not making enough money to go up into that next tax bracket, then technically you're still kind of stuck in the same situation. You may be making just a little bit more money, but guess what? You're paying a little bit more in taxes. So it's almost like you're still barely breaking even, if that. Another thing that I would do if I really needed money for stuff like that, like daycare, healthcare, all this stuff that I need in my life, I would apply for jobs that pay $20K more. And you're probably thinking, why would I do that? Because number one, I can, and number two, I'm worth it. That's why I was talking about my previous podcast about getting your resume together and writing down every job you've ever had on a piece of paper. And within each job, write down everything you did from the moment you set foot on the property of your employer to the moment you got home. Because those are the things that you did for your employer. That was the job that you did. So let's say, for example, how would I word this? Oh, this is a very good example. This is what I would do if I was not making good money and I needed way more money. Okay, so let's say, for example, you work as a data entry specialist. And you're like typing, and you're like really quick at typing. And, maybe let's say you type memos, documents, research papers, you're inputting numbers all day, something like that. But let's say you don't make good money. Let's say you make 12 to 16 an hour, okay? And in some places, 16 an hour is really good money, so let's lower that. Let's say you're only making 12 to 13 an hour and you're doing data entry work, right? Data entry work is almost the exact same job as coding when you're talking about computer and data analysis. It's just at a different level, and you're just working it differently. So, like, for example, every computer software program you have has to run on a code. Like, even on your phone, like these apps and things like that. That's how they function. It's kind of like the recipe for a cake. It's like you can't make a cake, you can't bake a cake unless you know the recipe. It's the same thing for computers and software programs. It's not going to function or run unless it knows what to do and what to put in there and how to function. So what I would do, if I was not making good money and I was just doing data entry, I would look up doing coding, not medical coding, but like computer coding. And one of the software programs I think is called Python and SQL. And when you look this stuff up, if you're not used to this stuff, if you're not used to management information systems, that's a MIS degree, or if you're not used to computer coding, it's going to feel and look and just seem like it's way over your head. But let me tell you something, it's not. Because some of the best people, some of the best employees I have found that are great at coding are people that started out in data entry because they're quick, they're sharp, they're smart, they know the keyboard like nobody's business, they understand computers at a level that most people do not. So just because you're at a low-end job, that doesn't mean you have to stay there, and that doesn't mean that you don't already have the skill sets and the talents to make way more money. So let me look up on my computer here, like what a computer, that might be, it wouldn't be computer programming, but computer coder. Coder salary. Okay. All right. Okay, so for a computer programmer, which I guess that might be technically what it's called, but I was thinking something else, the wages in the United States, the range for that is $42,000 to $100,000 a year. Now, if I had to guess why it goes up to $100K, is because there are different levels of management within computer programming and computer coding. So, let's see here. Oh, this is way better here. Okay, so I'm just Googling, and it says, do coders make good money? All right, and it says computer programmers get paid well, with an average salary of $63,903 per year in 2020. Beginner programmers earn about $50K and experienced coders can earn $85K. So look at it this way. If you're just a beginner in this, you can easily make $50K a year. That is way better than making only $12 an hour. So let me do the math of what $12 an hour is, because that's kind of around the wages for lower end jobs. We do the math on that. Okay, so if you're making $12 an hour, if you're working full time, your average salary before taxes is $24,960. So if you turned that talent you have for typing into computer programming, you would increase your income by $25,040. Now, just think about how much more of that money would be in your bank account. Big time. That could pay easily for childcare. That could pay for vacations. That can go towards your 401k. That can go towards anything that you want to purchase. That is really good money. So I look at it this way. If someone wants to make more money, they literally need to go out and make more money. Give it a chance. Just try it. And what I would do if I only worked in data entry, I would look up resume samples or also job descriptions that are for computer programming, and I would kind of splice or input those words from the computer programming job description into my resume for data entry, and I would change my job title from data entry to like data management or data specialist, because when you say data entry, that's just a job title. That's just a description. So there are a lot of things that it can have. You can be doing the exact same job, but you may have a different job title. And so a lot of these recruiters and companies, on the surface, the first step is they're just receiving all these resumes. They're not even reading them or looking at them. It's just being run through their computer-generated database, and they're just looking for specific words, specific phrases on your resume that will match with what they're looking for. So then on the second or third step in terms of finding an employee, that's when they actually look at your resume. So it really doesn't matter that you're changing your job title on your previous job, because job titles come and go. They change. Like you can be doing the exact same job but have different words to describe it. I mean, it's no different than using a thesaurus, and I love that because you can look up one word. Let's say you're looking up happiness. Let me look that up, and it will tell you other words that have the same meaning or similar meaning to happiness, but it's just a different word. Thesaurus. Okay, I love this, and I used a thesaurus all the time in college to help me write my English papers. And you learned more new words as opposed to just looking through a dictionary. Okay, so synonyms. A synonym means to have the exact same definition or a similar definition to a word. So I looked up happiness and all the different words. Oh, this is so good. So some very similar words to happiness are bliss, contentment, delight, elation, enjoyment, euphoria, exhilaration, glee, joy, jubilation, laughter, optimism, peace of mind, pleasure, well-being. Let's see, beatitude, blessedness, cheerfulness, content. I don't know what this other word is. I've never seen this word before, so I'm going to skip that one. Enchantment, gladness, rejoicing, playfulness, paradise, merriment. Oh, I haven't heard that word in a long time. Lightheartedness, hopefulness, cheeriness, good cheer, good humor, good spirits. So, it's the same thing when you're looking for a job. Yes, you may have been doing data entry and it may not be paying well, but those skill sets that you're using every day for your job can be used for a different job, just have a different job title, and double or triple your income. Who wouldn't want to do that? I say go for it. You have nothing to lose and everything to gain. So I wonder if this will give me other words on here. Let me look up something. Oh, yeah, this thesaurus. It doesn't like that word. Okay. I was looking up programmer, but it's really not for that because that's more of a noun. And the word I was looking up was more of a adjective kind of thing. So, but you definitely use different words to describe yourself because also that helps you get out of a rut. If you keep describing yourself in the same way, then it kind of fools your brain into thinking that you are never changing, you're always the same. That's not true. Like, look at it this way. You are a different person than you were just the other day. Why? Because maybe you tried some new type of food. Maybe you realized, hey, I really want to go to that store and shop there. It's like every day we're growing into a better version of ourselves, so don't ever stay stagnant. Don't ever just stay where you are. Like, always be open to having a better life and growing into something better. Because that's where you will have your success. Like, you have to leap. One of my favorite phrases is leap and a net will appear. And it's very true. You have to have that hope. You have to have that faith and you have to push forward. That's one of those things with that. But I wanted to bring up kind of what was going on in terms of federal mandates and stuff coming down the pipeline from the federal government. And, I kind of want to go back in time with this because I know that the federal government has been wanting to implement federal mandated daycare, I think, since the Clinton years, if I'm not mistaken. I was a little kid back then. But the adults that I was around at the time, and then later on when I grew up, they've talked about how the federal government really wanted to implement federal daycare. And back then when parents realized what it actually meant, they're like, no, we don't want that. Like, it sounds good on the surface. Oh, free daycare for all your kids, and you can go to work and make money and stuff. But there were all these other things that the government wasn't really telling people that they wanted to do, and how strict and stringent it is, and that you can't ever have a relative take care of your kid. You can't hire a babysitter to take care of your kid while you're at work. That really puts a stress and a burden on the parents, and then it makes it so that the parents don't decide who's actually taking care of their kids. So you don't know how your kid is being trained or taught. You don't know what they're around. And I'll give you an example. There are these people I know, they're kind of, well, the wife is stuck up and a snob. The husband's more normal, but they made a comment one time at dinner about one of their children and said, we don't know where she's getting these words, and she has this weird head movement that she's doing that's kind of ghetto. And then the next time we saw them, which wasn't long after that, they told us that they realized where their daughter was getting these weird ghetto words and why she was having this kind of weird behavior. It's because they met one of the daycare workers that was at this daycare they were dropping their kids off at, and they were just going, whoa, our kid is mimicking this woman because their kid is bonding with somebody else and not them. And they noticed that. They noticed that their kids were not as reliant upon them as they were before. There was kind of a shift or a slight change in the dynamics of their relationship the more they went to this daycare. And I don't know if they took their kids out of that daycare, but I would. I would make every sacrifice I could to be a stay-at-home mom. Because that's what I would be concerned with, is what are my kids being taught, and what mannerisms and words and jargon are they going to pick up from somebody that I don't even know, that's a complete stranger to my children, but yet they're going to be around my kids for 8 to 12 hours a day if they're in a daycare. That's 8 to 12 hours that they could be around a family member or someone that actually loves them and cares about them and, actually does have a meaningful relationship with them. It's not just a business transaction. That's what daycares are. It's you're paying someone to take care of your kid. Whereas if you're a homemaker or you're a relative, taking care of a child, you're not being paid to do that. And it's a much more kind and loving relationship than someone that you don't even know. And, I'm sure there are some really nice daycare workers, but when I heard this story from this couple, my mouth kind of dropped. I didn't really know what to say. But, this couple, they love money. They both work. The husband makes really good money. The wife doesn't have to work, but she wants to work. She wants to have her own income. She loves money. And it's like, well, if that's what you love, then I don't really think they have an avenue to complain about their kids and what they're being taught at daycare when they have a choice to have one of them stay at home and raise the kids until they go off to grade school. But that's not what they want to do, and it's not what the wife wants to do. So I just kind of find that odd. There was something else I was going to mention about France. I don't know how long France has been doing the government mandated daycare, but parents over there have been fighting that for such a long time. And what I find interesting is that if the French people really did not want that daycare system to be there, where it's mandated by the government and you're forced to do that, then they need to vote their president out. See, here's the thing. You have all these people that want a handout from the government, and then they complain about it, but they don't vote the right way. They don't vote to reflect what they're complaining about. Because when it comes down to it, they still want so-called free daycare, and it's not free. It comes out of people's tax dollars. And when I say people's tax dollars, that means everybody's taxes, not just the rich. And here's another thing. The rich, they pay way more in taxes anyway, but I don't think they should be on the hook for everybody's little whim. The rich are not the personal piggy bank of society. Because that's not right. I look at it this way. If I was a millionaire or a billionaire, would I really be okay with being taxed more than somebody else just so other people could not work, have free daycare, have free health care, but yet my money's paying for all that? And then the system that it's going into is not even really supporting or helping our society. I would not be okay with that. I mean, I would still be forced to pay taxes because I do believe in taxes, but, it's one of those things that I would try and help people wake up to the fact that, hey, if you're not really satisfied with something or about something, you need to take care of that at the voting ballot. That's, at the voting box. That, the elections that you have, that's where you make your voice heard. Because in the meantime, I personally don't care to hear people's complaints if they don't actually care to do anything about it. And do it appropriately. And I say do it appropriately because there's the right way to act and the wrong way to act. And the right way to act is to take care of this stuff when you vote and who you're voting for. And, I'll go off on a tangent here a little bit and talk about taxes. Like, I am all for taxes. We should have taxes. Everybody should pay tax. What I don't agree with is overtaxation of the rich, because it is overtaxation. See, because here's the thing. If everybody paid 10% of their income, that to me would be fair and reasonable. I don't think any type of tax should be over 10%. Because I think anything over 10% is extreme and a mismanagement of money. Because it just seems like whenever we raise the tax rates, it just leads to really bad stuff and mismanagement of money, and it leads to all these government officials and bureaucrats and all these people serving in office, they just have all these little pet projects. Well, if you have a pet project, you need to fund it with your own money, not everybody else's. Like, that bothers me. It's just not, it's not the right way to spend someone else's money, much less your own. So, I'll give this example with this. Like, if everybody pays a flat tax of 10% of their income, it doesn't matter whether you're making $100 or $100 million. The rich are going to pay more anyway because they're making more. All you have to do is move the zero over or the comma over one time for 10%, and that's how much they're going to pay. Like, if you're paying 10% on $100 as a tax, you're going to be paying $10. So, with the rich, if they're making $100,000, 10% of that would be $10,000. So, they're automatically going to be paying way more than someone who's in a lower tax bracket. Like these people that think, oh, we need to tax the rich 40 to 60 to 75%. Really? Are you kidding me? Like I would rather it only be a max at 10% because the rich actually do a lot with that money. And the rich do way more to stimulate our economy than any government ever could. See, here's the thing. Rich people, they invest in companies and they also invest in people. Our government does not invest in people. It takes money from people and it tries to reallocate those funds, and it doesn't even do it in a very good way. It's a mismanagement of money. An example of this is Medicare, Medicaid, I would say WIC, which is a government program for women, infant, and children, which I can't stand that program. It's horrible. And then how our veterans are being treated. So I'm pretty sure I'm probably irritating some people on this, but I'll just kind of explain why I don't like these programs and why I think that if we're going to keep them, they need to be run better. So first of all is Medicare and Medicaid. I know that with Medicaid, it's very much used in poorer states, and that's not a very good reflection of the stability of your economy in your country or in your state. The more people you have on Medicare, or let's talk about Medicaid first. Medicaid is for people that are not on Medicare. Medicare is for people that I think they're age 65 and older. I think is the age bracket for that. And with Medicare, when you hit 65 or 64 and a half, you are forced to go on Medicare. And that's now your government insurance. You're not allowed to purchase private insurance anymore. And the insurance, the Medicare insurance for older people is one of the worst policies ever. Because the government is notorious for not paying its bills. It's notorious for putting people on waiting lists. And it's also notorious for not wanting to pay for people's drugs that they desperately need. Like for example, if you need a drug and you've just had a transplant, the government is going to try and get out of paying for that drug. So what they're going to do is they're going to delay your transplant surgery, and or they'll try and see if they can find some crappy generic to give you as opposed to giving you the best possible drug on the market. Because what Medicare does is it says, okay, we know that in every other market, the cost of this drug is this, but because we're the government, we're only going to pay a fraction of that. Why? Because we're the government, and if you mess with us, we will federally take you out. We'll sue you. So basically, the Medicare, the federal government, they basically threaten these companies and these doctors' offices and hospitals and say, hey, we're not going to pay this, so you just have to do what we want because we're the federal government. See, that's the problem with putting your health care in someone else's hands, is that you don't always know what they're doing, and sometimes what they're doing is not always right or ethical. Because I look at it this way, if I was a doctor or a nurse practitioner or even working at the front desk of a hospital, would I think it's appropriate for someone to not pay their bill? I would think it'd be very inappropriate, but the federal government gets away with that all the time. And what's interesting is that the federal government likes to get paid, but it doesn't think that some of these doctors and hospitals and, pharmacies should get paid their money. Well, people need wages. But the federal government doesn't always care to pay people their wages and have it be appropriate wages. That's the thing. So Medicare is health insurance for older people once you hit a certain age, which I think is 64 and a half, if I'm not mistaken. And you're forced on that insurance, mandated by the federal government. And I think that is totally wrong because that's the federal government forcing you and making it illegal for you to purchase something that you may want to purchase. And plus, here's the thing. There may be quite a few rich people that they don't want to be on Medicare. They don't need to be on it. Medicare should be for people that need it. That maybe are super poor or maybe they're middle class, but they got hit with, some kind of mortgage crisis or something and they need to be on Medicare to help pay for their medicine. Medicare for all is not a good thing. So then let's go to Medicaid. Medicaid is for pretty much everybody else that's not old, that is put on the government health care policy. It's basically health insurance for anybody under the age of 64 and a half. And Medicaid, again, it doesn't want to pay bills. And I'll give an example. Like when I was having to try and find a new doctor because I got new health insurance. I noticed that there were so many doctor's offices that did not want to see Medicaid or Medicare patients because the government totally stiffs these people out of their money, out of their wages, and they're trying to run a practice. So it really puts the squeeze on people to try and find a doctor or a hospital that is in that network. It's very difficult. And that's not the fault of the patient, but it's the patient that suffers. It's you and me that suffer whenever the federal government does stuff like this and then tries to say, oh, our health care is the best. We want health care for all. Obviously they don't, if they're not even trying to pay their bills and pay them quickly. The federal government is notorious for not paying its bills and for delaying funds as much as possible because, first of all, it doesn't have the money to pay for all this. Healthcare is very expensive, but it doesn't have to be. And the federal government is not the answer. If anything, it has caused quite a few problems, especially with federal mandates in terms of the cost of healthcare. So that's Medicare, Medicaid, and then I wrote down veterans. Okay. You know, our veterans, they served our country and they protected our country and they come back home and they get the crappiest healthcare you've ever seen. It's worse than Medicare or Medicaid, and it's run by the VA. The VA has been a horrible organization for decades. It was like the white elephant in the room. It's like nobody wanted to talk about it, but yet the VA, they kept wanting all this money. They kept basically getting all this slush fund money, but it wasn't going to the veterans. It wasn't going towards their health care, and it wasn't going towards their needs that they need met. And I'm not talking about their families. I'm talking about the actual person that served in the military. The person that actually needs the health care. You know, like maybe they got hurt and now they can't work a normal job. Well, they need to be able to afford stuff and get the proper medical care. But what happens is these veterans, they get funneled through these VA clinics that are so crappy, so horrible, so mismanaged, and they're dirty and filthy, these clinics. I've heard veterans complain about this for years, that it's really scary when you go there because then they wonder if they're going to pick up some disease. And sometimes the workers that the government hires to work at the VA are just horrible. They're not the cream of the crop half the time for doctors and nurses and medical staff. And they're not always nice to our veterans, which is horrible. I would think if anybody should receive dignity and respect, it should be people that defended our country, like actually went to war for us, actually put their life on the line so that we could be alive and have our freedoms. I think the least we could do is pay their healthcare cost, especially if it's associated with a wartime industry or something that happened while they were overseas. But, you know, that's just another example of how the government mismanages money, but then you'll hear government officials, people in office say, oh, we got to take care of our veterans, we love our veterans. And they just go on and on and on, you know, let's wear the ribbon for our veterans. And I don't know what color ribbon it is for the veterans. Like breast cancer awareness is pink, but you've got all these other colors for every cause. And it's like, you know, wearing a ribbon doesn't pay the bills. Wearing a ribbon doesn't get people the health care that they're paying for and that they deserve. I say screw the ribbons. Get people the health care that they're supposed to get, that they were promised, and also that we, the taxpayers, are paying for. Like, it really bugs me that, you know, I'm paying all these taxes into a broken healthcare system, and yet it makes all these promises to people that they're supposed to protect and help, especially when they get out of the military, and they're not even taking care of the veterans that really need a lot of help. Like, some of our veterans, you know, sometimes they get their limbs blown off. You know, you can't just have someone sawing off their limbs and not know how to do proper amputations and you know, let's try and prevent an infection here. I mean, it really is that serious. It's not something that can just be, oh, we need health care. You know, no, it's we need health care. And we need to also take care of our veterans because there are some people that need more health care than others. Like someone that's healthy and is not in the military and, you know, they're here back at home in the U.S. working, they have a good job. They don't need the same services as someone that comes back from a war. I mean, they just don't. So the monies that are supposed to be allocated to the veterans in their health care, it should go to them. But what happens is this horrible mismanagement of money. And from what I can figure out, it comes down to everybody wants their hand in the pot. And it comes down to managers, HR departments, or administrators. Like, I cannot stand that word hardly at all anymore, because whenever you see the word administrator, and it's a job title within an organization, you basically need to just envision your tax dollars going down a rat hole, because we've got all these people that want all this power and they want to control other people's health care, but yet they don't want to be on the same health care plan that the veterans are on, because they know it's crappy and it's horrible. But yet these administrators, these higher ups, so to speak, or these bureaucrats, they're just professional paper pushers, but yet they get paid really good money, they get paid really good wages, have excellent health care, but yet when it comes to someone else's health care, they don't really care about, because they care more about their job, their money, and yet they say, oh, we need to help our veterans more, or oh, we're low on money, let's raise taxes, let's do the right thing. Well, sure, let's do the right thing. Let's have an audit first, and let's see why your administration or your cabinet or your department doesn't have the monies that it's supposed to have. How is it using it? And is it using tax dollars appropriately the way that it's supposed to be utilized? And also, are workers getting paid the correct wages? Like, yes, we have doctors and nurses, but what about all the other workers that are below that are in lower income brackets? Are they being paid appropriately within these government systems? Like, if they're working at the VA, are they working the best hours for them? Are they being guaranteed pay? Are they working in a good, happy environment? I can probably tell you no, they're not, because the VA is not known for being a pleasant place to work. If anything, people can't stand working there. And you know what? It starts with management. It starts from the top and trickles down. It just does. So, in regards to a lot of these government entities and programs, social welfare programs, just FYI, whenever you see the word administrator and they've got a job title, they're basically a professional paper pusher. And here's another thing. If you interview them, they may sound like they know it all. They're smart. They make it seem like they care. But you know what? The proof is in the pudding. Like, I've worked in accounting for like 12 years now, or 13 years. You need to look at the numbers, because that will tell you if someone's actually doing their job and doing it correctly and handling the monies in a appropriate manner, because tax dollars are just that. They're tax dollars. They come from everybody's paycheck. So that means those administrators and those people in those government offices and roles, they are held accountable by the taxpayers. And the way that they're held accountable is when you go to the voting booth and you vote them out. Or you vote someone in that can fire those people that are not managing the VA or these other offices in the appropriate manner. That's just how it should be. And I wish more people would wake up to this. But I bring these up, Medicare, Medicaid, the VA, because if our government can't even handle these social welfare programs, how's it going to handle daycare? And you're talking about children. You're talking about babies, infants, toddlers. And these, more than likely, are 99% healthy, Like, our government can't even take care of people that really need a lot of help. So how are they going to help parents? How are they going to help mold and shape our kids? They're already trying to implement stupid stuff in the public school system, like trying to eradicate history and try and push through these really crazy nutbag theories that have nothing to do with the beginnings of our country and what it means to be a citizen and to care about your fellow man. I mean, if anything, they're teaching stuff about how to have disharmony in your country, and we don't need that. It's easy to be negative. It's harder to be positive. And the reason why is because it's worth striving for. It's worth longing for positive things in your life. So that's kind of a serious podcast. But I thought I would bring it up because I've heard people talk about, some of what the federal government is doing. And there are good things that the federal government does, but it really needs to help those in need first before it tries to expand out to other things. And I'm sorry, daycare is not number one on my list. The people that are dealing with life and death situations, they're number one. The people that need food, water, and shelter, they are number one. Daycare and school systems, that comes second, third, fourth, fifth, sixth. It's down the list. People need medicine. They need their cancer drugs. They need transfusions. They need infusions. They need a roof over their head. They need the vaccine. They need transportation to and from their doctor's appointments. Things like that. We really need to put things in perspective and put it in the proper order. Maybe someday this daycare thing will be a good thing, but I don't think it should come from the federal government. Not by any means. I think that's very dangerous to put the federal government in charge of anything like that, because whenever you give them power, it's very hard to get that power back. That's the thing. I would be very concerned with that. Regardless of whether I have kids or not, I would still be concerned with that. Big time. For example, I'm not on Medicaid or Medicare, I'm not a veteran, but yet I can easily recognize that those programs are not being run correctly, and the people that need help are not getting the help that they need and that they're promised. When you make a promise, you're supposed to keep that promise. And if you can't keep that promise, you need to admit that, hey, I made a promise I can't keep, I apologize. Let me see what I can do to make up for this. But the federal government doesn't do that. That's what these social welfare programs do. They make all these promises they can't keep. Why? Because they're constantly spending someone else's money. They're not spending their own money. And they're not really holding themselves accountable to anything. It's just viewed as a slush fund. Well, people are not slush funds. They're people. And their wages belong to them. And when they pay their taxes, they expect the government to spend their tax dollars in an appropriate and business-like manner. Be smart about it. Big time. So that's kind of a slightly not as positive podcast as some others, but it's one of those things that we can't just ignore the white elephant in the room and just sweep some of the stuff under the rug and ignore the dangers of this. And, because it is dangerous to implement all these different social welfare programs when we have a huge deficit, we have a huge debt in this country. And, the programs they're wanting to implement are not the best thing for this country. We're not even able to handle the government programs that we have that are being practiced right now. So that's a big problem to me. We need to get our head on straight and practice good management. Big time. So, just so to end this podcast on a positive note, I'm going to read some affirmations from that affirmation app that I love. Because I look at it this way. Yes, we do need to address things in our life and in our country, but we don't have to let things end on a sour note, and we don't have to only focus on the negative. Because are there going to be negative things? Yes, but we can always be positive. So again, be positive about your life and realize that, regardless of what gets passed or what doesn't get passed in the federal government or in the states, whatever the case may be, today is still a good day. We still have a life worth living, and we can still have happiness every day of our life. Don't get down in the dumps about anything. It's not worth it, because when you get down in the dumps, it tends to affect how we process data, our brain. It directly affects our brain, and it affects our mood, it affects everything. So, yes, you can address negative things, but always come out on the positive with it. So, I am in the I Am app, and it says, today I give and receive love. All I need to do is follow the habits that lead to success, and I will achieve my goals. I avoid toxic people. I am thankful for all the people in my life. I trust that I have the capability to achieve my goals. Life has a way of reminding of how blessed I am. I appreciate my life. I deserve to be respected. I live my life with gratitude and happiness. There is no such thing as mistakes, only lessons. With a sense of gratitude, I see the world in a new light. I have abundant energy, vitality, and well-being. I give thanks every day for the simple pleasure of being alive. I am deeply grateful for the opportunities to push past my limits. I am thankful for all the times I have smiled this week. I like that one. That one's making me smile. I like that. Love multiplies in my life. I am going to get out of this. I was reading this wrong. I'm going to get out of this stronger. That's good. Anything is possible because I believe in myself and my capabilities. I believe in my ability to truly love myself for who I am. My heart is always open. I am grateful for all the blessings that I have. I move on to my best future. Believing in myself comes naturally to me. I focus my energies on the many positive things in my life. I will stand by my decisions. They are sound and reasoned. I am confident in my ability to change my life. I am great at helping people. Every day I am becoming a better person. I am becoming the person I always wanted to be. Today I will have an attitude of gratitude. I trust that all I need comes to me when needed. I choose to make my happiness a priority. I love that one. Because you have to choose to be happy. It doesn't always just fall out of the sky. I wish it did, but, we choose it, therefore we can have it anytime we want. But I just want to thank you for listening in on this wonderful podcast. And as usual, I pray that you're happy, healthy, whole, that you're very prosperous and blessed. And until we meet again, have a wonderful day, a wonderful week, and just be wonderfully blessed. So have a good one. Bye-bye.